Further with our topic, let me introduce myself. My name is Dr. Tanvi Desai, and I'm practicing in Marthali, Bangalore. I'm a gynecologist and a laparoscopic surgeon. I'm associated with GVK and Cloud9 hospitals and also consulting at RxDX and Children's Clinic here in Marthali, Bangalore. So, let us begin our discussion about today's topic, that is exercise in pregnancy. Throughout pregnancy, we come across that a lot of pregnant women have lot of doubts, and they don't know whom to consult, what to follow, what not to follow. To add to that, in India, there are a lot of cultural beliefs and taboos considering this. Women are skeptical about whether to exercise or not. Can I bend? Can I climb stairs? What exercises can I do and what I cannot do? And there are a lot of elderly female relatives in the family who will be giving a lot of do's and don'ts. So to help clear the confusion, I am here today. So let us talk about what are the benefits of exercising during pregnancy. So exercise during pregnancy has immense benefits. During pregnancy, a lot of women are anxious and stressed and they are not able to sleep properly. Exercise helps to relieve endorphins, which in turn can help to keep the stress at bay and they are able to sleep properly. Also, exercise will help to relieve the back pain, leg swelling that women experience during pregnancy. Another important benefit of exercise during pregnancy is that it will help to keep your weight in check so that after delivery you can lose all your pregnancy weight and get back in shape faster. Uh, we all are aware that being active and exercising during pregnancy and doing the household chores like mopping the floor, using the Indian toilet, all these activities help to strengthen the pelvic muscles and then make the process of delivery easier. So that is also one important reason why exercise during pregnancy is very important. And all these activities help to improve your breathing also, so that you can have proper breathing during your labor and delivery. And last but not the least, your recovery after delivery will be faster if you are active and exercising throughout your pregnancy. Uh, so let us discuss what kind of activities and exercises we can do in the first trimester of pregnancy. During the first trimester of pregnancy, if your body has already been used to doing certain activities like swimming, jogging, walking, yoga, etc., then you can continue to do the same exercises during the first trimester of pregnancy. But always make sure that you consult your doctor before going ahead with any such kind of activities, because you need to know the status of your pregnancy and whether it is recommended in your clinical scenario to continue the exercise. In case you are not used to doing any kind of exercise before pregnancy, then do not be adventurous and start something new. You can start with doing some mild exercises, like you can do walking for 30 minutes in the morning and 30 minutes in the evening. And you can do some mild exercises to help stretch the neck, back, and leg muscles. For example, when you wake up in the morning, you might notice a lot of stiffness in your body. So to relieve that stiffness and pain, you can start with doing some stretching exercises for the neck, like moving the neck up and down, moving the head from side to side, rotating the neck. All these you can do for 10 counts. Then you can do some rotation exercises for the shoulders, forward and backward, and rotating the hips, rotating the ankles. All these are mild exercises and they will help to relieve the stiffness that you usually experience while waking up in the morning. So, but you have to ensure that always before doing all these physical activities, you are taking your doctor into confidence and going as per your doctor's advice. In case you have an incompetent cervix or there is a cervical stitch, or you have a low-lying placenta, you're experiencing bleeding, spotting, or leaking per vagina, then in that scenario, it is not recommended to do exercises. So please consult your doctor and follow your doctor's advice before doing any such kind of activities. Uh, and so let us now discuss what other issues or exercises you can do. Many women experience body pain and back pain during pregnancy. What can be done to deal with that? The first and foremost important thing to deal with this is to ensure that you are taking your calcium and vitamin D3 supplements regularly. That is half the battle won. Because during pregnancy and during lactation, the body's demand and the baby's demand for calcium and vitamin D is higher. That's why you need to ensure that your calcium and vitamin D levels are optimal. Then only the other measures can help you in relieving the back pain. The next important step is ensure always that you have a good posture, because during pregnancy the weight of the pregnancy causes a strain on the back and the posture is changed. All these factors lead to back pain. So once you ensure that your calcium and vitamin D supplements you're taking regularly, then you can complement it with some back stretching exercises like the popular cat and camel pose. Another example of exercise is that you have to do a wall stand. You take the wall for support and stand with your back towards the wall and make sure that your head, buttocks, and heels are touching the back. So you can be in this posture for 4 to 5 minutes and try to do this at least 5 to 6 times throughout the day. Another simple exercise is sit on the floor in erect posture and gradually bend forwards and try to touch your toes. This will give a good stretch for your legs and your back. So these kind of measures will help to relieve your back pain and body ache. Some people have doubts that what can I do during the third trimester to help me have a normal delivery or an easy delivery. So please continue to do whatever exercises you have been doing in the first trimester and second trimester. And then in the third trimester, you can add on certain exercises specifically which will help to make the process of delivery easier and help you to have a normal delivery. So you can do wall squats, use the wall as support and do some squats. You can do lunges, you can do butterfly, duck walk, and Kegels exercises. The purpose of all these exercises is mainly to strengthen the pelvic muscles and improve the stretchability of the pelvic muscles so that it will be easier for you to have a normal delivery and your recovery after delivery will be faster. Some people may have a doubt in their mind that I have never done any exercise or I'm not doing much during pregnancy. Is it okay or what should I do now? So it's okay. It is recommended that you do at least 30 minutes of moderate exercise regularly. But in case you're not able to do that, 10 to 15 minutes is also good enough. You can continue doing for 10 to 15 minutes and then gradually increase the duration and add on the mild antenatal exercises that I have suggested in the beginning. Also, other important exercises that can be very helpful during pregnancy are yoga, Pilates, Lamazi. All these types of exercise can also help you during pregnancy in case you are not used to doing any other kind of exercises. But always remember, before doing all these activities, you should consult your doctor first and do it under the guidance of a proper antenatal trainer. So I think now we can take the question and answers. If anybody has any questions, they can ask me. So there is a question, is it safe to exercise in the first trimester? Uh, Yes, like I told you earlier, if your body is already used to doing a certain kind of exercise before pregnancy, you can continue to do the same exercise even during pregnancy. Uh, but make sure that you do not have an incompetent cervix, or you do not have a cervical stricture, low lying placenta, or any bleeding. For all these things, you can consult your doctor, and with your doctor's advice, you can go ahead with exercising during first trimester of pregnancy also. I always give an example that there are a lot of sports people, persons, women, like for example Serena Williams, or lot of sports people in Olympics who have won medals and won tournaments during pregnancy. So you can be as normal as possible and do all your routine activities and do your exercises also during pregnancy. Okay, somebody has asked me which hospital do I practice. So I am practicing at Jivika Hospital in Marathalli, Bangalore. That's on Outer Ring Road. And apart from that, I'm consulting at RxDX Clinic, Children's Clinic, and Practo Nurture Clinic in this area. Okay, somebody has asked a question, Mrs. Anuja Deshpande. Till my fifth month of pregnancy, I was only walking for 30 minutes twice a day. Please suggest what exercises I can perform now onwards. So now already you are in the second trimester of pregnancy. So along with walking, you can add on some mild antenatal exercises like stretching of the neck and back and legs. Like I told earlier, you can start with bending your head forward and backward. Like make sure you're touching your chin to the chest and then backwards. So you can do that 10 counts, then move your head from side to side, rotating the neck clockwise and anti-clockwise. So you can do this 10 times. Then for shoulders, just shrug your shoulders up and down gradually. Rotate your shoulders in front and then backwards, and you can rotate your arms forwards and backwards. So you can do all these exercises at least 10 counts forwards and backwards to help stretch your neck and back muscles. And along with that, during the third trimester, like I already said, you can start with wall squats, lunges, butterfly, duck walk, and Kegels exercises, which will help to strengthen your pelvic muscles. Okay, somebody has asked a question, till which month of pregnancy should I exercise? You can continue to exercise till your delivery. There is no problem. There is no hard and fast rule that you need to stop exercising before few days before the delivery. You can continue to be active and continue to exercise till the very last day. Uh, we already discussed what are the benefits of exercise during pregnancy. Somebody has asked, I experienced a lot of body pain during pregnancy. Are there any exercises that can help to relieve it? Okay, this body pain and back pain is a very common problem that a lot of women experience during pregnancy. That is because the weight of the pregnancy is bearing on the back and the posture of the back changes. Because of that, women tend to have a lot of backache. Another important factor is deficiency of calcium and vitamin D. So before doing any exercises, you need to ensure that you are regularly taking your calcium and vitamin D3 supplements. And then there are some back stretch exercises, like you can do wall stand, take the wall for support, stand with your back towards the wall, and then make sure that your head, your buttocks and heels are in contact with the wall, and then stand in that position in erect posture for at least 4 to 5 minutes. You can repeat this at least 5 times throughout the day and gradually increase it. Then you can go for the cat and camel pose, which will help to stretch your back and relieve any back strain. Also, like I told earlier, you can sit on the floor, make sure your posture is erect, your back is arched, and then stretch your arms in front and gradually bend forward and try to touch your toes. So this will give a good stretch to your hamstrings and back muscles. And otherwise also, if you're sitting in a chair, make sure that you are sitting in erect posture, and then you can just twist and try to hold the backrest. You can twist in both directions. That will also help to stretch the back. So you can do all these basic exercises which will help to relieve your body pain and back pain. Someone has asked a question. I am 6 months pregnant and I only go for walks once a day for 15 minutes. Is that okay, or I need to start exercising? Okay. It is recommended by gynecological associations across the world that you do at least 30 minutes of moderate exercise throughout pregnancy. In case you cannot, even 10 to 15 minutes is good enough. But after that, you can try to gradually increase the duration of your exercise. Like supposing if you are walking for 15 minutes only, you can increase it to 30 minutes once a day, and then try to do at least 30 minutes in the morning, 30 minutes in the evening. And slowly you can complement it with the mild antenatal exercises that I've already discussed about earlier. So you will definitely see the benefits of exercising during pregnancy. Okay. Now, next question is, I was recently diagnosed with low-lying placenta. Should I completely restrict any physical activities? Okay. Uh, Low-lying placenta is a slightly complicated pregnancy. Uh, So there is no need to completely restrict your physical activities. There is no need to do bed rest. You can go about your self routine activities in the house. But regarding exercise, depending upon what is the status of your placenta, whether you have any bleeding, depending on all those things, your doctor will guide you better whether you can do any exercises or not. So I think I have clarified your doubts regarding exercise during pregnancy, and I hope you have found this talk informative. Uh, it would be great if you all can inculcate whatever tips I have provided for exercising during pregnancy, and you will reap the benefits of it. So thank you very much. I would like to share that you all can follow me on Baby Chakra using my code Tanvi D, that is TANVI D. You can also use this code to avail of amazing discounts on a variety of Baby Chakra products on the website. So remember, you can follow me using my code Tanvi D, that is TANVI D. Thank you.